So we'd like to welcome everybody to today's session. This is our first, it's on loneliness and companionship, and it's the first in the series on isolation and loneliness. It's facilitated today by the Eden Alternative. Many of you attended our first LAND series on grief and bereavement, and we're really glad that you're here today to continue learning with us. This series is part of Teaching Resilience and Empowerment to Elders. It's the Learning Action Network, and it's called the WellbeingTREE. It's brought to you by Altarum with grant funding from the Michigan Health Endowment Fund. Altarum is a nonprofit. We're headquartered in Ann Arbor, and we've been in existence for over 70 years. We help federal and state health agencies and foundations improve health equity and outcomes through better systems of care. From lower-income children to nursing home-eligible older adults, our mission is to help those whose health is negatively impacted by social determinants. My name is Ann Hicks-Donatis. I am a long-term services and support specialist with Altarum. As I said, we're excited to bring you Altarum's WellbeingTREE, and this collaborative learning platform offers Michigan nursing homes tailored learning to better recognize and implement evidence-based strategies to improve the conditions of social isolation, loneliness, bereavement, and grief in their homes. So we thank you for joining us today. We want to work together with you toward creating healthier homes in Michigan. In the first series on grief and bereavement that was facilitated by Dr. Tony Miles, we discussed strategies to better recognize and understand bereavement and grief in our coworkers and in our residents, and to know how to better manage the individual experiences with bereavement and grief, as well as improve the ability to cope and help others cope with the same. So the materials from these sessions are available on the WellbeingTREE website, and we really encourage you, when you have a minute, to go check those out, because Dr. Tony Miles did a fabulous job identifying for us grief and bereavement and the key elements of that and what that might look like in our nursing homes. We know that COVID has impacted the nursing home residents and staff by taking something that already happens in nursing homes, the death of our residents, and it complicated it because we saw our residents died in much larger numbers through the impact of COVID. And in some of our homes, we lost staff as well. That makes for the perfect storm of bereavement and grief. Bereavement and grief can contribute significantly to feelings of social isolation and loneliness. Grief and bereavement do have that direct impact on social isolation and loneliness. People who are bereaved can push others away. Due to the anger that they're experiencing, they can become isolated as a result of sadness. Isolation can lead to loneliness, and in terms of loneliness, research has confirmed that the loneliness has frequently one of the major challenges that you experience when you follow loss. There are key indicators that loneliness could play a role in depression after loss of a close person, and loneliness is associated with complications in grief, including post-traumatic stress disorder, depression, mental and other physical ailments. So why does social isolation and loneliness matter? Why does it matter? Why are we talking about this? Why have we dedicated a series to it? Social isolation is among older adults is associated with greater risk for dementia. It can also cause premature death from all causes. It has a mortality risk that is equal to or even greater than factors like smoking or obesity. And the goal of this series is to give attendees strategies to help decrease social isolation and loneliness in our homes and in the care that we're providing to our residents. And I do want to point out to you that in 2021, CMS issued guidance to state health officials to begin adopting models that illuminate the underlying effects of social, environmental, and economic factors. And these social determinants of health can have greater impact on health outcomes, even greater than the impact and the delivery of the health services that we're trying to provide in our homes. You can see in October of this year, the MDS 3.0 draft may include 7 new social determinants of health, and one of these is social isolation. So that's how close it's coming, and why we want to be able to identify it and look for opportunities to improve it for those in our homes. So on to the Eden Alternative. In the first series on grief and bereavement that was facilitated by Dr. Tony, we did discuss the strategies on how to deal with bereavement, grief, and the impact of social isolation. The Eden Alternative was created with the quest to eliminate the 3 plagues of loneliness, helplessness, and boredom. That's what they are created for. They're dedicated to creating caring communities where elders live and promote quality of life for elders and those who support them as care partners. and they've been doing this since 1994. So I'd like to introduce to you today the presenters that we have. We are so excited to have Chris Angevine and Meredith Martin with us here today. Chris is an Eden educator and an empowered teams coordinator. She has had the pleasure of teaching over 1,000 change agents. So we are in good hands today with Chris. She's a community builder. She consults with and supports organizations with implementation. She creates resources. She develops educational tools and materials and supports networking opportunities between individuals and organizations. And Meredith Martin is head of Eden Services, which includes education, consultation, and learning tools. As an Eden educator, Meredith has taught hundreds of change agents about the impact of loneliness, hopelessness, and boredom, and the power of person-directed care. So I am pleased to introduce to you now Chris and Meredith from the Eden Alternative.
Thank you so much, Anne. We are thrilled. Meredith and I are thrilled to be here today with you to discuss something that we obviously feel is so important. And also, loneliness kind of touched a lot of people's lives during the pandemic. So, interesting topic, obviously one very important to us at the Eden Alternative. There's lots of ways that we can stay connected with people. We know that, but for some reason, it doesn't always work out. It could be our situation. It could be bereavements. One of them, I know my mother-in-law right now is just having a hard time connecting with anybody. And she just recently lost her husband of 60 some years. We also believe that ageism plays into it, and ableism can play into social isolation and loneliness. We're really going to explore how this impacts our own lives and also the lives of people around us and the people we may support who live where we work. We're also going to talk about something which is the antidote that we talk about at the Eden Alternative, the antidote to loneliness. And then through this, we're going to talk a little bit about the connection between, as you can see on the screen, loneliness, social isolation, and how it really affects our physical and mental health, because it does. And there is the research now to prove that for sure. So we're going to start with understanding kind of loneliness. And then in the next two sessions, which we're very excited about as well, we're going to explore ways to overcome that in our own lives and the lives of others. So that is kind of our objectives. We would like to kind of begin by giving you a little history of the Eden Alternative and kind of talking about our 10 principles, which to us, we have our 10 principles, which you have a handout on, hopefully. And I know that they have sent that to you. And we believe that the 10 principles are kind of like the vehicle you're driving in, and the destination is really well-being. It's a contented state of being for all. And that's the destination that we talk about at the Eden Alternative. So I am going to turn it over to my teammate, Meredith, to talk a little bit about the 10 principles and what they are. Thank you.
Thanks. And thanks, Anne. Thanks for that wonderful introduction. And I would be remiss if I didn't just acknowledge how much time and longevity Eden has in the state of Michigan. So if this is not news to you or not new to you, maybe you can just look at it with a, kind of a beginner's mind. But if you haven't heard of the Eden Alternative, I'd like to just tell you a little bit about why we got started and why we're even so passionate about loneliness, helplessness, and boredom, as Anne stated. So back in the 90s, Dr. Bill Thomas and his wife, Jude, started the Eden Alternative at one single nursing home in upstate New York. It was a small grant-funded initiative, and our beginning story started when Dr. Thomas was doing his rounds, as most doctors do when they're, assigned a nursing home rotation. And he visited a woman with a rash on her arm. Seen many rashes, probably, I would imagine, at this point in his career. But what happened in those next moments, whenever she reached up and she grabbed Dr. Thomas by the arm and with the bluest of blue eyes looked at him and said, "Doctor, I'm so lonely." And he didn't really know exactly what to do with that. He was like, "Oh, yeah, yes, ma'am, I understand. But he didn't really understand. And he walked out of that room changed. 3 words changed him just like that. And so he had seen many people, but what he decided to do was to not be so busy when he was at the nursing home the next time he was there. And he sat and he observed and he watched. And he sat in the common areas, and there weren't many of them. And he watched and he listened. And what he learned quickly was that the people that lived there really weren't suffering with ailments he could help with physician orders, or that he could help with different modalities or different treatments. But the people living there and working there were really suffering from loneliness, helplessness, and boredom. So that's kind of our how we got started story. And over 30 years ago, we have yet to eliminate loneliness, helplessness, and boredom, but we're very passionate about opening people's eyes to what that might look and feel like, because once you see it, it can't be unseen. So with that, now, over 30 years later, we've been in over 30 countries just last year. So we're a global nonprofit, really, with a quest for well-being for all, not just those requiring care, but those who support them as care partners. We care about your well-being too, whether you live there, you work there, or you visit. So with that being said, principle one, I do want you to just reference them highly before I pitch it back over to Chris to dive in. But principle one states the problem. And the problem is that loneliness, helplessness, and boredom are painful and destructive to our health and well-being. So if we know that they're painful, and we know that they are, and we know that they're destructive, principle two of the Eden Alternative gives the solution. A caring, inclusive, and vibrant community enables all of us, regardless of our age or our ability, to experience well-being. So those are principles 1 and 2. The next 3 principles are called the antidote principles because they give us creative and inspiring ways to fight the 3 plagues of loneliness, helplessness, and boredom. We're really going to hone in on principle 3 with our time today on the loneliness, but they're plagues of the human spirit, and they're very painful, and they're just as devastating as any disease of the human body. Now, the rest of the principles, because they're 10, 6, 7, and 8 are the practice principles because they challenge us to change our practices and give us opportunities to deepen our understanding of what person-directed care actually is. And then finally, principles 9 and 10 is all about a growth mindset and wise leadership. So nothing happens to change the culture of care or to eliminate loneliness, helplessness, and boredom without a growth mindset and wise leadership. So I'd like to just turn it back over to Chris as we explore a little bit more about loneliness and its antidote of compassion.
Thank you, Meredith. So well spoken, as always. I love it. So looking back, like she said, we're going to concentrate on principle number 3. When we talk about loneliness at the Eden Alternative, we really talk about loneliness as the pain we feel when we want companionship and cannot have it. The pain we feel when we want companionship and we can't have it. So when we talk about loneliness, there's some definite things to remember about being lonely, right? So loneliness can really cause pain and diminish our well-being. We've talked about that a little bit. The typical institutional model, it really teaches us that the antidote to loneliness is to keep people busy, right? Either through programs or activities, or sometimes just projecting what we think somebody needs in a very well-meaning, believe me, we are really want the best for people many times, but it's what we think it is. And it's not individualized to what that person really wants to do to relieve that loneliness. You know, we know that you can be in a crowded room and still feel alone, and you can be alone and not feel lonely, right? There's that point of solitude, which is very different. We also know that loneliness can affect anyone at any age. We believe because of some things like ageism, or it could be what you were talking about, bereavement. People may be just at a higher risk as they are aging, and that may be something that comes into play. But we also know that loneliness is curable. But as we found out, and Dr. Thomas found out, there's really nothing in the medical model that gives us what to do and how to treat loneliness. We really say, principle number 3, the antidote to loneliness. Principle number 3 teaches us that we thrive when we have easy access to the companionship we desire. Now, I can't say we desire enough, because believe me, what I want for companionship is not going to be the same as you. And I can guarantee that. Even if we all love puppies or dogs, I love big dogs. I don't like little dogs. So there's some subtle differences when we talk about companionship that can really come into play. You know, I don't have any children. So if you bring in a bunch of children and you think that's going to give me companionship, or you still call me grandma, that's not going to work for me. Another thing we talk about is deep knowing relationships and really knowing each other. And that really helps with that. Another definition we wanted to talk about was companionship. Again, it's that companionship we desire. And what does that look like? I know sometimes when I've been working in different homes or organizations or facilities sometimes, is that someone's in distress. They're having some unmet needs, what people would normally call behaviors. So they're on a one-on-one. Hopefully that will help them. Well, now not only am I distressed, now I have some stranger following me around all the time. And everywhere I go, this person is, and I don't even know them. Is that the companionship we want? I don't know. Really something to think about. So the companionship we desire is so, so important. It's individualized. And the last thing I want to talk about when we're talking about definitions is really about a care partnership. Care partnership. We often talk about caregiving and care receiving. And at the Eden Alternative, we truly believe this is a two-way street. It never feels good to always receive. That's not something I want. I want to give back, right? It doesn't feel good to always receive, and it doesn't feel good to always give. It feels good for a while, but not always. You have to receive. So that's why we talk about a care partnership. And we define care partners as the people who are accepting support from us, the people who maybe are giving some support, family members, volunteers. You know, everybody's in this care partnership together. That's a little bit about some of those definitions that we're talking about. I think we have a word cloud, maybe a word cloud or two for you all in the audience. And I see some good comments already. But the first one we're going to ask about is what words, or maybe it's just a word, best describes how loneliness feels. So this is a poll that you could put in there and just submit. And this is really talking about what word describes how low, what does it feel like? Sometimes we have to step back and think about this, because we could talk about it, but really think about it. What does it feel like? Have you ever felt lonely? Got a couple of responses coming in. Nice. Couple in the chat box. Cold, empty, distant, helpless, lost. Yeah, you'll notice we talk about loneliness, helplessness, and boredom, and they do play into each other sometimes, for sure. All right, 24 responses. Kids are doing good.
Empty, scary, helpless, distant, lonesome, hopeless, a lack of purpose, sad and lost, seclusion, stuck, scary, distant, apathetic.
Not a lot of words that make you jump up for joy, for sure. So let's go ahead and move on to our second poll that we have. And this is really kind of demonstrating the difference here. So we talk about loneliness. What about solitude? What does solitude feel like? Is there a difference? I believe there is. At the Eden Alternative, we believe there is. Solitude. What are some of the words that describe how solitude feels to you? Yeah, I'm definitely one of those people that just love to take myself out for lunch. I like to go shopping by myself, you know. I'm perfectly fine with that. That makes me happy.
So Chris, here's what we have so far as they come in, but peaceful, relaxing, energizing, regenerating, quiet, grounding, choice, privacy, sanctuary, soothing. Definitely different words there.
Definitely different
Definitely different feelings there.
Yes, and I think my favorite word right there was choice. You know, that is. When you're lonely, are you having a choice? And that, I think that's a huge word that came in on that, and lots of other good ones. Thank you. So thank you for taking your time. I'll take a little time to do that. Again, just kind of stepping back instead of always talking, really trying to put ourselves in there and feel it and think about stories where you know people or yourself when you've been a place where you're in solitude. It feels okay, or you're lonely. So thank you. I'm going to turn it back over to Meredith. And she's going to talk a little bit about the domains of well-being.
Yeah, so we've been teasing these up here on the screen for you for a little while, but years ago, actually, the Eden Alternative brought together a lot of really smart thought leaders on a task force. And what they were tasked to do was to actually explore the concept of well-being in depth. And I appreciate Anne's reference to CMS and different guidelines and regulations. And I'm just here to let you know that the Eden alternative domains of well-being are actually quoted in the CMS regulations. Actually, and I believe it's F tag 679, taking it back to my nursing home days. And it's really all about not only emphasizing how important it is to actually know someone, right? So that's where that identity comes in and our personhood and actually being well known to each other. And then when we know each other well, it makes it possible for relationships to grow and deepen. And that's where we create the connectedness. And I think in the chat earlier, I saw someone state that sometimes it's those people that move into our communities that at very first, when they're first getting kind of introduced, that they don't know anyone, they don't know much, that maybe that's when it's more likely to hear that, "Doctor, I'm so lonely." Well, maybe it's because their identity, they're not known well yet either. They not only don't know our systems and what we have going on in our communities, but we need to create those opportunities for deep knowing. Then when you get into security, once you feel connected to other people and your environment, we can feel safe enough to really express ourselves and express our right to choose, which is what autonomy is always about. As Chris said, that was one of her favorite words and one of those word clouds. But if we ask all of ourselves the question, it's one of our most important words as well. I am a parent. I'm a parent to an almost 2-year-old, and I guarantee you choice is very important to him. Choice is very important to all of us. It does not go away, your need for choice. So when we have our autonomy and we can state our needs and we feel connected in our community, then we can actually engage in meaningful purpose to our lives. And that's where meaning and growth, and whenever all of these domains work together, then you really do get to that 7th domain of joy and experiencing really fulfillment in your lives, both in for people who live in our communities, but the people who work there and who visit there and the family members. We at the Eden Alternative feel like well-being is important for all of us. And, you know, as individuals, we understand what these 7 domains are because we all need them. And when you look at person-directed care through the lens of well-being, it becomes so less abstract and much more concrete. So with the domains of well-being, it really invites us to reflect on what we each hold dear in our lives. What do I want someone to know about me? What relationships are important for me to foster and to develop as I become older or more frail? So it's really it's a great framework, the domains. You know, I think Chris started us out with, it's our destination. This is where we want to go. And it's all about a life well lived. And so with the domains of well-being, we really encourage people to use them for problem solving and thinking creatively about care planning and supporting each other's growth. When we look at the domains of well-being, it's like once you've seen and you feel what loneliness, helplessness, and boredom look and feel like, once you know what these domains of well-being, what they mean to you and what they mean to others, we start to get more to the root of the issue instead of dealing and only reacting to symptoms. Because a lot of times, some of those so-called behaviors that we might see are actually truly unmet needs where someone's domain of well-being is not yet being met. So again, we're thankful for CMS's recognition in what true well-being looks like. And yeah, I think we're going to go into the domains much deeper in the next 2 sessions, but just wanted to introduce them to you here. Thanks, Chris.
Thank you, Meredith. And thank you, Alexa. I see a comment in the chat box that really makes sense. It makes sense for the residents that don't want to participate in activities or leave their room. And sometimes they don't feel, like Meredith was saying, that could be because they don't feel connected, or they don't find meaning maybe in what's happening. Or they could just be scared. Maybe they don't feel secure enough, whether it's in themselves or in their surroundings. It could be many things. Just a quick story about security. There was a lady, and she became very close with one of these employees that had worked with her. It was a nurse, and she would go in to see this lady, and this lady didn't like to leave her room. But every time she went in, the lady would never want her to leave, right? She wanted that companionship. She wanted that companionship so much. But the nurse obviously had other things to do. She couldn't stay in there all day with this wonderful lady. So she worked up a plan with a teammate of hers, and they had the little walkie-talkies. So every time she was in there, after 5 minutes, her teammate, a fellow nurse, would call her and say, "There's an emergency. We need you out here." Well, that worked pretty well until, guess what? What happened to that lady and her sense of security? Now, she didn't go out of her room very much, hardly at all. So what she began to think was, she lives in a place where there is an emergency happening all the time and every day. And she got scared, right? Her sense of security went out the window, only because they were trying to do something without hurting her feelings, get her out of the room without trying to put her off. So we really have to be careful sometimes when we look at these domains of well-being. Lots of good comments in the chat box. So moving on a little bit, holy pandemic, right? Are we done with it? Not quite. I was just visiting some homes in Kentucky. Shout out to Kentucky. So I was just visiting some homes there. And, it's really just from the different places that I visit, it's really hard coming out of this, isn't it? I had one director of nursing say, "Chris, before the pandemic, we were on a cruise ship. We were sailing. We were person-directed care. Great. People were feeling that this was their home. Everybody was coming together in a care partnership. And then the pandemic happened, and I felt like I was on a battleship, and everything just got sucked down. And as an industry, we really swung hard in the direction of safety, right? And we had to. Something different was coming down every day. Like, who knows what's going on? It was a time very much so of unknowing. So opening back up again, I guess that's the only way I can kind of say it. It's hard. It is hard. A couple things about the pandemic, and you can see her up on the screen. How did it personally change your world? And what did balancing that safety and well-being look like? And then what did you do to relieve your own loneliness? A couple thoughts there for you to think about if you want to put something in the chat box. I can tell you from our perspective, talking to different organizations that had gone through the pandemic, the people who worked with us before really seemed to have an agility to them and a flexibility to problem solve kind of on their own as a team. So they had some skills already built that really did help alleviate loneliness for people. They figured out different ways to personalize so many different aspects, whether it be even personalizing people's dining trays. They found some wonderful creative ways that came from the team, because really in leadership, we're all running around trying to do just the best we can do. And the fact that the team had some ownership over things, they did pretty well. And we've also learned that smaller is better. We always know that smaller groups working with smaller groups are better. And again, when we talk about loneliness and becoming well known, those are some of the things we've really found that happen. And even in a large organization, I worked in a huge nursing home that supported 475 people in skilled nursing. And yeah, I didn't know how big that was until I left and started talking to other places. But what we really started to do was break down those huge units and hallways. And we got to the point where we broke this down to 22 small homes where you had the same group of elders working with the same staff. And I believe that's when some magic can happen. The smaller is the better. And it doesn't take huge physical transformation. It does take effort and some education for sure. but we do know that smaller is better. So anything coming up in the chat box?
Yeah, so Whitney said that social distancing became so ingrained that it's hard to get out of the house to even do things she used to enjoy.
Yeah.
Christy said still lonely, and I could relate to that. Now Amanda said she has an animal assisted therapy background in addition to social work. So she got more pets during the pandemic. She had spouse and immediate family support, and FaceTime became a go-to for other relatives and friends. Ashley, I too had a child during the pandemic. Ashley said she had a child during the pandemic and live in an area where many felt COVID wasn't real. So she had to keep boundaries for her child and for her resident safety while upsetting many individuals. She then took over as the DOA and had to continually think of ways to meet the psychosocial needs for all the residents without group activities, outside resources, performers. It truly was the heart of the staff that helped keep our residents safe.
Thanks for chatting. It was tough. It was definitely tough with the pandemic. I think the biggest thing to look at, again, as we're opening up from the pandemic, is this is just what I've been kind of seeing out there, is that we really got used to being back to being in charge a lot as leaders, as CEOs, as infection control, and we had to be. Sometimes the decisions just had to be made, and we had to tell. And I think it just brought us a little bit back into that world of maybe perhaps not asking the people that live there or the people that work closest to them what might be a good solution, right? About day-to-day life, right? And that's where we talk about, principle number 8, empowerment, but that really does feed into loneliness, helplessness, and boredom. If no one ever asks my opinion on anything, I kind of feel isolated and lonely out there. I always say it all the time. Everybody wants to be a player, not a pawn. I want to be involved in my own life. And how does that happen at the place you work at, the place you live at, the place where you have your loved one? Again, how do we go back to, which we call our solution statement, come back into community? That's where we used to be many, many years ago. And for many reasons, it's gotten away from that. And a vibrant, caring, inclusive community really works on that, again, what we call the plague of loneliness. So continually thinking about ways. And if you're stuck, for me, whenever I'm stuck on anything, I just start asking questions. I think it's the most beautiful thing in the world. Whether I'm up educating or coaching, consulting, working with people, if I'm not quite sure, I start asking questions. And it's always the people who are in the midst of it, or who are doing it, or who are living it, that come up with the best answers. So when we're thinking about alleviating loneliness, I just think that's really something to keep in mind, is keeping people involved. Thinking about some research. Now, listen, there is a bunch of research out there talking about loneliness and how detrimental it is to our health. We know it's detrimental to our mind and to our well-being, but also, we've learned that loneliness can have really serious impacts. Research reveals, and this is from our teachings, that people experiencing less human interaction have poor sleep patterns, altered immune systems, more inflammation, and higher levels of stress hormones. Again, one study concluded that isolation increases the risk of heart disease by 29% and stroke by 32%, just by loneliness. And if you want, there's lots of other definite research out there talking about, there's different studies that talk about it, mortality rates. Feel free to go ahead and look at, and do a little research on that, but that is definitely back out there. So that would be something really talking about impacts that physical and mental health loneliness. I just want to tie back into, when we say it's a public health concern, is ageism and ableism. They really play into it. We're taught from a very young age that if we're not doing something, whatever that might be, and you're just being, that you may not have worth. Now, I know, and I think you all know from working with different people, that I get so much from the people that I've gotten to know, that I've been blessed to be able to support. I have gotten so much back from people. But if we're in a society that really listens to the ageist and ableist messages out there, we may not think that aging adults, people with differing abilities, are worth our time. We really have that to kind of I think, fight against as well when we're talking about loneliness. I don't know if anybody has any thoughts on that.
Something to be really mindful with ageism, and that being that prejudice against people because of their chronological age. It's not just older people that ageism impacts. It impacts young people. We have ageist attitudes and mindsets towards young people. We have ageist mindsets towards our future older selves. We're ageist against our own selves. So it's widespread. It's all around us. You can't buy a greeting card after someone's 13 years old, I don't think, and it not be completely ageist. I think they've taken it down to 13. Just tease it. No, right? Once you're over the hill, they say that it's all downhill from there. But yeah, as Chris said, it's sometimes because of our mindset on people, and ableism being discrimination against someone because of their ability. But it's because of those ageist and ableist mindsets that we create the cycle of loneliness, helplessness, and boredom. Because when we don't feel like we can give what we used to give, or how we used to identify ourselves as, say, farmer or an entrepreneur or a business person, and once we don't define ourselves in that way anymore, we may be less likely to raise our hand and have a voice and exert a choice. And so it's like the ageism and ableism stimulates the cycle of the loneliness, helplessness, and boredom. So you really have to face all of it head on to be able to stop that endless cycle, is all I would add there.
Thank you. Yeah, absolutely. Thank you, Alexa, for coming back into the chat box, just relating it to your grandfather, where he feels he has less purpose when he's not working. And I've seen it so many times. And so how do we value people for just being, or value people of all ages? And I thank you, Meredith, for bringing that up, that, ageist views against, how many times, I'm just going to say, how many times have you heard this? The millennial, there is no work ethic anymore. Those millennials, again, yeah, they don't work like we used to. So yes, being aware of all that is so important. So we're going to give you a little growth work. So hopefully we'll see you in the next 2 sessions. So what we really sometimes it's important, and we say this during our training, but we talk about getting our Eden eyes on. And what we really talk about, that may sound a little silly, but we like to phrase it so you really think about it. And it's looking at your home, your community, your organization, whatever it may be, through different eyes. Pretend you've never seen it before, and be curious and non-judgmental coming into it, just with a fresh mindset. You've never seen any of this before, and really walk in and think about what is going on in this environment. What's going on with the different processes that we do? It could be our delivery of mealtime. It could be a care plan. It could be, how do we welcome people? How do we talk to people? A big hot topic is stay interviews these days. How are we talking to people who stay with us? Because that can be lonely too. If I'm out here being a star performer, giving it my all every single day, and I look around and other people aren't, I'm out here 120 and all around me is 80%, I may feel pretty lonely as an employee. Think about that, and then write down some examples of those interactions that you see that may lead to loneliness. Then kind of think, okay, what have we really done in our home and community to kind of focus on combating that? What have we done to work on loneliness? Because we know loneliness and isolation with this pandemic has been sometimes quite out of our hands. So what have we been able to do? And this is really playing on the strengths. And we want to hear from this, because I've heard so many great stories from organizations that have done some really cool things. They're small,
really creative. Yeah.
Right. Like, I argue, are they small? Because people say, oh, that was just such a little thing. And I'm like, little to you. This is probably huge to some of the people that are accepting support from us. So really, what have you done? We want to talk about some good stuff. And then we're going to challenge you to have at least two conversations with those around you, just about these issues: social connectedness, isolation, and loneliness. And you can talk about companionship too. Companionship we desire. What does that look like? And this last quote we're going to leave you with is a quote from DeWitt Jones. We have a video that we show in one of our trainings, and this is what he says. He's a photographer, and he says, the lens we choose transforms the way we look at things. Well, thank you. We'll look forward to seeing you, and we're not seeing you or talking to you again.